Health information management employees are essential to maintaining accurate medical records for hospital and clinic patients. They must ensure that records are maintained in a manner consistent with medical, ethical, legal, and regulatory requirements and standards.
Coding technician reviews the medical record after the patient has been discharged from the hospital. Each diagnosis, each procedure that any you can imagine, each one has a code number. And we review the record, we look at the physician documentation in the record, their progress notes, their dictated reports, the discharge summary, and from that we look for all diagnoses that were treated while the patient's in the hospital.
A release of information worker would come in and look at our requests to make sure they're HIPAA and state compliant. They also would order some of our charts to get the records out. They would use our electronic system to go ahead and print records. They would mail records out to our requesters, and they also handle the incoming phone calls for attorneys, insurance companies, or healthcare organizations.
A typical day for a medical transcriptionist would be sitting at a computer, typing a record that is dictated by a physician. This can be difficult depending on who the dictator is and their dialect and their style of dictating.
A document imaging technician would come in, and we receive our records to scan into our electronic file several times during the day. They would prep them in document types by breaking them down into different sections. They would also take the staples out, make sure we have the right patient together, the right pages in the correct order. They would also bring up the patient in our electronic system to scan it into. After they scan it, they would go ahead and do QA to make sure that we have the right patient, the right document type, and also all the pages are present.
Physician liaison actually is a liaison between both the hospital and the medical school, and I work with attendings and residents and nurses in making sure basically their documentation is done within a certain time period. And that time period was set through the hospital as 14 days.
Employees who manage health information work with medical information that comes from many sources, and they are constantly updating and using current data. They also perform day-to-day administrative tasks that require them to possess strong customer service skills. It is imperative that they communicate effectively, not only with coworkers, supervisors, and billing agents, but also external customers and patients. Health information management employees use a variety of technologies and equipment, including phones, fax machines, copy machines, scanners, microfilm machines, transcription machines, keypads, and computers, where they use word processing, the internet, and database software. Much of the work done by health information management employees involves using computers to track paper medical records and documentation deficiencies, perform coding, and scan documents into the electronic medical record. Computers are used to access resources and reference guides, as well as a variety of manuals and data formats which ensure the accuracy of record information. Responsibilities also include communicating to internal and external customers via letters, memos, and email. Employees in health information management must possess strong skills in organization, attention to detail, communication, standardization, reading comprehension, accuracy, problem solving and conflict resolution, time management, information ordering, phone skills, and computer knowledge.
Verbal and written communication skills, computer skills, medical terminology.
Knowledge of medical transcription and medical terminology, and also anatomy and physiology.
Ability to concentrate. attention to detail.
Being able to make snap judgments on situations that might not have a supervisor available.
They should have a high school diploma or equivalent and possess vocabulary skills and knowledge of medical terminology. Many positions require specific technical and certificate training as well as college-level coursework in order to be qualified for the job.
Coding technicians require thorough knowledge of coding guidelines.
Experience in medical records in order to be able to weed through things and do a little investigation work on inpatient documentation.
The work environment for the health information management employee can range from solitary, encoding, transcription, or registry, to more physical or interactive situations in filing and release of information, scanning, and chart completion, where they work with other medical personnel as well as with families and patients. When a health information management employee chooses to leave the job, it may be because he or she finds the work too repetitive, needs more contact with other people, or wants more job variety. But more often than not, it is because the employee gains a promotion through advancement in the organization, or after completing additional training certification. Health information management employees play a crucial role in maintaining the confidentiality of medical records, as well as keeping complete and up-to-date records, which are essential to ensuring that services provided are billed accurately. The important work of managing patient medical records ultimately ensures that doctors, nurses, therapists, and other medical personnel can treat patients safely and effectively.
I think the most rewarding part as a coding technician is the continuous learning.
Also rewarding is being able to work with the other transcriptionists and working as a team.
And you have a patient come in and trying to get their records in a very short amount of time because they're going to see a second opinion. And you were able to get those records together in a very short amount of time, and they walk out of the door and say thank you. And I walk out of work that day knowing I made a difference in someone's life.